Hi, I'm delighted to talk to you about Aspire, which is a new partnership program grant that we've been awarded by Bone Cancer Research Trust and Sarcoma UK. And really this is aiming to use nationally collected cancer data to identify inequalities and improve outcomes for patients. So this project started in 2019, so quite a few years ago, really on the basis that essentially all patients with cancer are registered in the National Cancer Disease Registration, and lots of information about their treatment and outcomes is also collected. And so some of that data is used routinely by trusts and the NHS to understand what's going on, but because of the complexity of sarcoma, it wasn't possible to understand what was going on. And that's because there are 100 different types of sarcoma, and they happen all over the body. And so we were very grateful to Sarcoma UK initially for funding us to try and develop the methodology to better understand kind of what's happening to our patients. And this has led through to a number of publications and incredible insights into the difference of care for patients across the country, and most notably the importance of being treated in a specialist centre. And that allowed us to show, particularly for retroperitoneal sarcoma, which is a really difficult tumour found in the abdomen, that if you get treated in a specialist centre, your chance of being alive 5 years later is 10% higher than if you're not. But on top of that, if you go to a high volume specialist centre, it's another 10% higher. So it really just shows you how important experts are in treating patients. And we're now working with the NHS to see whether the retroperitoneal surgery can be organised in a different way to improve outcomes from that. So on the basis of that, we then did an analysis of bone sarcoma patients, looking at differences in outcomes and showing some great improvements in their outcome over the last 5, 10, 20 years. And we think to a certain extent, again, based on patients being treated more and more in specialist centres and that centralisation of care, which is actually second to none. If you compare us to other parts of Europe and the US, where people are treated all over the place, I think it's one thing that we should be proud of within our NHS. Having said that, there are clear inequalities, and there are lots of patients that are not having access to certain treatments depending on where you live or depending on what type of tumour it is. And so actually that's what this new programme grant is to understand what's happening to patients that are treated in the NHS with work streams and objectives based on a stakeholders meeting we had in July last year, bringing the whole community together. Again, patients with lived experience were front and centre of this, and we had a multidisciplinary team, all different disciplines represented right across the country. So we came up with a whole lot of objectives. Number one was about early diagnosis, delays in diagnosis, and also getting to the right place. And so we know that this is a problem, again, because the tumours are all over the body. They affect patients of all ages. They're going through all different complication pathways, and also there are lots of delays in the primary care. And so we've teamed up with an academic GP, and we're going to focus on that as one of our primary aims. But then also, as I said, patients want to know they're having access to the best treatments possible. So we simply using the national cancer data to see what treatment people are having in different parts of the country. That includes kind of standard of care, things that we should be having, and then also radiotherapy and proton beam radiotherapy, which of course is really important, particularly in Ewing sarcoma, but also in chondrosarcoma and chordoma. There are new drugs available to patients on compassionate access schemes, but not everybody seems to be doing them, or we don't know that. So we're going to find out these things. And what is the impact of it? Ultimately, if we can identify inequalities in different groups, whether it's an age issue or a geographic issue or a particular sarcoma issue, then we will have that data. Then we can now then work with the NHS to kind of improve the services and kind of deliver resources in a better way.